I actually ended up doing my own research around acai berry. I started looking at that and trying to understand how that was helping the people and why this particular blend of the product in a liquid form was helping the people, and specifically my friend, more than anything else we tried. And some of the features became real apparent to me how this product could be working, and one of them was that it had a lot of anti-inflammatory properties and antioxidant properties, and those actually do help with inflammation, and they actually quell the inflammatory response, and that made sense. Being in a liquid form was also helping the people actually benefit because it became much more bioavailable than any of the capsule or powder form that we were using before. What I've been doing with my patients is I do pretty complex surgery with them. And one of the things that I've always done with my patients is I've always given them an antioxidant vitamin preparation. And I've always done that specifically prior to any of their surgery. Because what I found is when people have a good supply of antioxidants and are taking a lot of nutrients and vitamins, that they actually heal better. And then in our complex surgery procedure, I want everything to heal optimally and quickly. And so I don't even leave it up to the patient to take whatever vitamins they choose. I've been always giving the patients vitamins from my office. So this has been a feature that I've done for years, especially as I got more involved in anti-aging medicine. I realized many people are nutrient poor that come to me for surgery. And so what I did is I made a substitution. What I substituted, it was the standard vitamin preparation that I was giving my patients prior and during their surgery, and I just substituted. And what I found is three things. One is that all of my patients, enjoyed and in fact were very reliably took their nutrient blend. They completely, in fact, sometimes they were better about taking than they were about taking some of the other things like their antibiotics and things that I wanted them to take as well. They were always very reliable and religious, which kind of told me that they felt the product was worthwhile and was important for them to take. The second thing that I found is that I had great results in wound healing. I didn't have any infections, and I have had very few, like what we call wound breakdowns or failure to heal or any of those kinds of things, the events that we really don't want to see when we're doing elective cosmetic surgery. And then the third thing I found is that some of my patients, after they finished, when their healing was done, what they would do is they would just ask me where they could get more, and I would ask them, that why, what were they seeking, and then several of my patients just said, I've had terrible joint pain, and specifically one patient said, I've had hip pain for more than 5 years, and he says, I've been adjusting my diet, I've been going into the gym and getting lots of exercise. He said, and he said he even works with a personal trainer to kind of keep him limber, but he said that he as of late has been having to cancel his personal training session. Actually, his hip pain went away, and it's the first time he was pain-free in 5 years. And so he told me then that he never wanted to be without again, and he actually has had it ever since. And we've been seeing things like that, just without any, questioning or just spontaneously, the patients would come back to us and just say that they just felt better, they have joint pain that's gone away, and they just wonder what was going on. Probably, I think that there's three things that are contributing to people's, from my understanding of the research, and I think that there's three components that are really helping anybody, and this would be people with joint pain or people, who just want to take it for its anti-aging benefits, or people that just want to take it for what we call to normalize their system. And number one is I believe that the fundamental properties is that it's an anti-inflammatory blend. That the American diet is very pro-inflammatory. Things that we eat cause a lot of inflammation, and we in the Western world and the American diet have many more chronic diseases than the rest of the world. And so I believe that it's an anti-inflammatory and it helps people in a very natural way with using Mother Nature's own fruit blends to quell the inflammation that's being brought into our bodies. And number two is that when we just do the active part of living, and that's just moving and being active and being physical, we create a lot of what we call free radicals in our body. So the more exercise we do, the more free radicals we produce. And I tell my patients all the time that free radicals are just, it's just the waste product of energy consumption. Our body, we take in food, we make energy from it, and part of that energy creates what we call free radicals, which actually damages the system. And it's been known since Linus Pauling, back when he got his Nobel Prize, that antioxidants actually help with the quell some of the damage from free radicals. And so packed with those antioxidants, which actually help with the repair from all the free radical damage. And we